Today we are discussing whole body hyperthermia and its use in cancer. My name is Johanna and I'm a pre-medical student. I would like to take you along with me as I interview several physicians using this modality.
In 1900, the lifetime risk of cancer was 1 in 40. In the 1940s, it was 1 in 20, and now it's about 1 in 3. That means 1 in 3 people will get cancer in their lifetime. Can a suppressed immune system lead to cancer? It appears that it does. For instance, HIV is a viral infection which causes severe immunosuppression by destroying certain T lymphocytes. Can this lead to cancer? According to an internal medicine reference book, up to date, quote, HIV-infected individuals have an increased propensity to develop malignancy, end quote. We'd like to see how to effectively fight cancer. One approach is to strengthen the immune system and then turn it on to help the body fight cancer.
We know the way a disease is cured is by our immune system. And whether it's a common cold or whether it's metastatic cancer, and immune enhancement is the greatest thing, the best thing, and the only thing that can really help fight disease.
In order to fight an infection and to fight cancer, we need to have a strong immune system and to have that system turned on. Fever is what turns on the immune system. Fever acts like a concert conductor of the orchestra of the immune system. It tells each system to start playing its part. For instance, T lymphocytes are white cells with antiviral and anti-tumor properties. When an infection occurs, fever works to call T lymphocytes into action. Fever also increases T lymphocyte production. This is one of the ways the body fights a virus or tumor. In some cancers, a fever is generated by the body to turn on the immune system. For instance, I had a patient whose only symptom was night sweats after a fever. After ruling out an infection and an autoimmune disease, I checked a CAT scan and it revealed a renal cell carcinoma, that is, a cancer of the kidney. It had not spread, so the surgery which he then had was curative. In many cancers, however, a fever is not generated. In these cases, an artificial fever can be induced to turn on the immune system and help fight the infection or tumor.
I'd like to introduce you to Dr. Salpe. He received his doctorate of medicine in Germany in 1995 and also opened Sweden's first complementary cancer clinic. Currently, he is the lead physician at the Arcadia Clinic in Germany. Part of the approach to treating cancer is whole body hyperthermia. I had the privilege of speaking with him over a Zoom conference call.
I very much believe that whole body hyperthermia is a very good treatment in a multi-level, multi-faceted treatment approach for many system diseases, inclusive cancer. Let me tell you a little bit about the history of it. It was developed in Germany and other countries like Japan in around the 60s with special devices that produce infrared heat and lead to a controlled production of fever in the human body up to the level of what is natural, what the body would do in case of a virus infection, for instance, a flu. So one of the first devices that were developed in Germany were developed in Dresden by a very famous physicist called Manfred von Ardenne. He was at that time one of the most famous physicists in Germany and a worldwide recognized physicist. He was in contact with a Nobel Prize laureate Otto Warburg. Otto Warburg, who was already an elder gentleman at that time, and Manfred von Ardenne in Dresden talked together about the origin of cancer and what one could do to treat cancer, and they found out together that to induce fever under controlled circumstances and to add vitamin C and a multi-mineral supplement and oxygen could actually be something that helps cancer patients to stay alive longer or to hopefully overcome the disease or go into a remission or at least a stabilization. The idea with whole body hyperthermia, vitamin C and oxygen was to not kill the cancer cell, but to help it to recover from its energy crisis and to go back into the normal cell cycle. And I want to say that whole body hyperthermia is like maybe a tenth of what we do. It's one component and we do many other things. So a typical protocol for a cancer patient here is one whole body hyperthermia treatment a week. The procedure takes around 3 hours. We start, let's say, at 9 o'clock in the morning with a foot bath, which is a gentle and very comfortable way to raise the circulation of a patient. And then we let them paint with crayons on a big piece of paper, whatever comes up into their mind, and we tell them, everybody can do it. You don't need to be an artist, or you are an artist already. Just express the mood of the day, and then the nurse comes and helps the patient to go into the whole body hyperthermia device. We have two different ones. We have actually one from Dr. Heckel and one from Professor von Ardenne. So we have both. The von Ardenne does it a little faster. It has more power, and it has 6,000 watt infrared lamps from underneath. And then it's like a hammock on top of the lamps, where you lay on this hammock undressed, and you're covered with a thin foil of gold-coated, it's like these emergency foils that keep the warmth. They're very thin, very light on top of the patient, so that the warmth stays a little longer in their body. You can see pictures of both on our website, www.arcadia-cancertreatment.com is the website. You can go to whole body hyperthermia and see the pictures. With the lamps on and the heat on, the patient eventually feels the heat, and pulse rate goes up as the physiological reaction of our body to heat. So with the pulse rate around 110, around 120, we keep the patient eventually at the temperature of a little above 103 and not more than 105 for an hour and a half. And then the nurse assists the patient to tolerate that with cold swabs on the forehead and as much liquid as the patient needs to drink to replenish the needs of water while the patient excretes toxically loaded sweat.
As we have seen in Germany, the Arcadia Clinic uses infrared light to generate a fever. At Weimar Institute, the New Start program uses a hot water bath to accomplish the same effect.
The first thing we want to know is, what is your temperature? What is your blood pressure? And then after we get those two things, then we have them drink some warm water to help with the core. They get into the tub, and then what we found more recently is that if the water's not very hot, they can get into the tub and get submerged, and then you keep adding more and more hot water. But what they also do is they'll put ice on the heads, and that helps out a lot. And they if you can get the carotid arteries under, there's a lot of blood that goes to the brain. That helps the temperature go up. And some people, the second treatment, they'll get up to 104, and they can hold it there for 20 minutes. Some people will never be able to get over 102.
Another physician that I had the privilege of speaking with over Zoom conference is a retired psychiatrist and founder of Quackwatch. Dr. Berry takes a rather different approach towards whole body hyperthermia.
As a general thing, the idea that if you raise body temperature, it will be a treatment for cancer simply has not worked. About 25 years ago, I was one of the people who edited papers for the American Cancer Society, their position statements on the various unproven methods, and I just remember that, but I've not really been following the literature.
So what does the literature say about whole body hyperthermia? Scientifically, is it beneficial?
There are studies documenting the elimination or shrinkage of tumors when hyperthermia is added to radiation therapy. A study by Vanderzee in 1983 noted, quote, "The results of whole body hyperthermia in combination with radiotherapy are much more promising. A complete response was achieved in 5 out of 18 patients," end quote. He also noted that 4 out of 18 patients had partial response, that is, shrinkage of the tumor size by about 30% or more. Also, we venture to ascribe the results achieved in 5 patients to whole body hyperthermia treatment. Fever therapy was also effective in reducing or eliminating tumor when added to chemotherapy. A study by Joan Bull in 2001 documented this. Fever range hyperthermia, that is, temperatures of about 104 degrees Fahrenheit rectally, was added to cancer protocol in 37 patients. Previously, standard cytotoxic chemotherapy had failed to stop the growth of the tumor in 35 of these 37 patients. When fever range hyperthermia, that is, temperatures of about 104 degrees Fahrenheit rectally, were given over 6 hours, when this was added to cytotoxic chemotherapy, there were significant side effects from the chemotherapy. However, despite the side effects, when hyperthermia was added, 1 out of 37 had tumor disappearance, 41% had 30% reduction in size of the tumors, and 19% had a tumor growth arrested during the study period. Thus, 62% of the patients responded to the hyperthermia when added to the chemotherapy.
From this, we see that the literature has presented positive feedback regarding whole body hyperthermia. It does actually appear to be beneficial. More research still must be done, however, since double-blind, clinically controlled case studies are still lacking. While whole body hyperthermia is not a cure for cancer, my hope is that this video has given you a glimpse of its potential in a whole body treatment approach to cancer.